In this video, I want to talk to you about runner's knee. I want to talk about who suffers with it, what actually is runner's knee, and most importantly, the 4 tips that you need to be working on to make sure that you either don't get or get rid of that annoying runner's knee. And I warn you, this is one that I'm particularly passionate about. So let's go. Checking out the channel. My name's John, head therapist at John W Sports Injury. Thanks for checking us out. Here we want to be doing 3 simple things. We want to help you to understand your body more so you can get rid of your pain, so you can go and achieve those sporting health wellness goals. But what I want to be talking about today is runner's knee, and we're going to kick off by talking about who suffers with it. Now, perhaps you're thinking it's obvious, runners, and you would be correct that runners are the typical people, and in particular long distance runners, that could be suffering with this condition. But it's not exclusive to runners. It can also be present in our clinical experience in cyclists, in long distance walkers. What's the common denominator? Well, we know that this is an overuse condition commonly suffered by people that are doing lots of repetitive same speed sports. So do we suffer it in football, cricket, rugby, tennis? No, it is in the running, cycling and endurance-based events where we're looking to do things over and over again. But what is this runner's knee? Well, what runner's knee is when we suffer with a pain on the outside of the knee. So that's looking where we're getting a pain around the outside of the knee on what's called our fibular head. The fibular head is the lower leg bone. So we have our tibia and then we have our fibula, and it's a pain around this bone. Now, what the condition is actually called is ITB friction syndrome, or ITB standing for iliotibial band. Now, if you've been around the running, cycling world, you're probably familiar with this phrase of iliotibial band, or ITB. It's often considered the black spot or the nightmare diagnosis that we can get. But what we actually want to understand is what's going on, because the ITB gets some bad press when actually this technically might not be the ITB's fault. It's taking all the blame and we shouldn't be blaming it. So what is the ITB? Well, the ITB is a big band of fascia. What fascia is, we have fascia all over our body. It surrounds our muscles. I describe our body as a bit like an onion, where we have the bulk of the onion, which is the muscle, the skin around the outside of the onion, and in between the skin and the muscle, we have what's called fascia. But in the onion, it's that plasticky layer. So if you think of it like that, but around the body, we have these thick parts of muscle. So what is the ITB? So it's a thick band of this fascia, so just come off camera here, that's running from our hip down to the outside of the knee. So it's running through our leg here. And so what generally happens is that when we are pulling on this structure, this ITB structure coming down to the outside of the knee repetitively, we can irritate the point where it's fixed on the outside of the leg bone. And so it's ITB friction syndrome, or runner's knee. But what I want to dive into now is the most important thing, which is my 4 top tips for you to make sure that you understand exactly how to get rid of it or how to stop it in the first place. And remember, when I get to that 4th tip, this is where I show why I am so passionate about this one, because it comes from personal experience and why it actually stopped me from running a marathon. But firstly, the first thing we want to think about is the flexibility of the muscles that can be affecting that ITB. Now remember, the ITB isn't a muscle, it's fascia. What does that mean? It means that we can't stretch it. Now, you may have seen ITB stretches. You may have heard people talking about stretching your ITB. But what we do really know is that ITB, or fascia in general, doesn't have the properties as such to be stretched. So you might also have heard people say, well, you can't stretch your ITB, so don't bother with stretching. But the point that I think people are missing here is that what we can do is act upon the muscles that might be acting upon the ITB. So what muscles are those in particular? Well, the ITB we mentioned runs from our hip and it runs down to the outside of the knee, and it actually joins into our glutes and our hip flexor areas. So these are key areas for us to be working. It also runs almost in between, the ITB sandwiches in between our quads and our hamstrings. So they are some of the key areas for you to be stretching and ultimately assessing your flexibility. So how do we assess your flexibility? Well, what I want you to do is I want you to lay down and join me now, where we're going to go through some of these flexibility tests to see if you are suffering with some flexibility issues in that area. Now, a reminder, what we might want to do is start with the good side, the uninjured side, to give our baseline findings, and then compare that to the bad side. So If we kick off by looking to test our glutes. So for this, what we want to do is lay nice and flat. And if we are working with the theory that our right side is the injured side, we want to lift the injured side up so our foot's flat, bring our other foot on top of that, and then simply look to lift through. Now, what you should be feeling is a pull in the glute area there. And what we're looking for here to be ascertaining or understanding is, are we getting pain in that area, or ultimately, do we find that we are restricted in this side? But then what we want to do, importantly, is compare it to the other side. So we do the same test, and there comes our comparison. Do we feel tighter in those glutes on the injured side? Can the lifting leg not get as far? They are indicators that we might be suffering with a lack of glute flexibility. Now, the good thing about these tests is we can turn those directly into stretching exercises, and a reminder that those stretching exercises we want to hold for 30 seconds. So if you're found that you're tight in those glutes, not a problem. That test that we did, add that into your stretching program every day for 30 seconds, and then you'll be able to track your improvements. Let's move on to talk about the hamstrings. I mentioned that the hamstrings and the quads almost are sandwiched by this ITB, so they're acting upon it, and I find that they can be really almost glued up into that ITB, creating some extra pressure upon it. So let's compare our hamstring range, or understand our hamstring range. So if we kick off with the uninjured side, being our left side, all we want to do here is lift our leg straight up, and we're looking to importantly keep the knee nice and straight, our hips nice and flat and on the floor or bed, and lifting as far as we can go. Ideally, we're looking for about 90 degrees. My hamstrings aren't perfect, so you should be able to get a little bit further than me. But where we were there, if we're above about 80 degrees, that's our normal ranges of motion. Then we want that comparison on the other side. And what you might find here, like with me here, is I'm unable to get my leg as far. I instantly start to feel some tightness, perhaps even in the quad muscle, but the hamstring really starting to pull. That's showing me that my hamstrings are restricted on that right hand side, and that will be an important stretch for me to be doing for 30 seconds every day. Now, the final one that we want to be working on is our thigh muscles, or our quadricep muscles. Now, we can judge this by laying onto our front. And again, I'm going to kick off with my uninjured side, and I'm looking to lay nice and flat and bring that foot up. You'll notice that my knees are tucked in, everything's nice and straight, and I'm trying to get that foot to touch the bottom, which I can do there. If I compare that to the right hand side and I feel that I start to struggle, I'm perhaps unable to pull that any further, these are indicators that we're tight through those quad muscles. And that is something that we can then implement, like with our hamstrings and our glutes, to ultimately be doing that stretch of 30 seconds every day until we find that we're nice and even on both sides with our full range of motion. My second tip is really about managing the symptoms. So what we want to be doing here is making sure that we're not putting excessive pressure on the outside of the knee. And this is where some of our massage tools may come in. So if I just reach for some of my favourite ones. So if you've got anything like a massage stick, or this can even just be a rolling pin, these can work really nicely in rolling into some of those tight areas. Now again, what you might find if you're suffering with this pain on the outside of the knee, or if you're just a runner or a cyclist in general, you'll be finding that those quad muscles can become very tight and very bunched up, and you can feel these adhesions. So what we look to do is use these tools to just try and roll out that area. If you find a sore point, hold on that area, small micro movements around that area, and then carry on rolling. So these come in really nicely, in my opinion, for working on those quadriceps muscles. We can be looking to do the same thing with something like a foam roller for the quads or hamstrings, but then we can come on to one of my favourite tools, and this is where I use this to really look to get into those glutes, which what we will find with ITB friction syndrome is the glutes are probably the biggest player or biggest influencer of that ITB. So we want to get something like a dense ball. I use a lacrosse ball. If you've seen me before, you'll know I'm a big fan of these lacrosse balls. But what we can look to do is just sit onto this lacrosse ball. Now, from here, what I can look to do is maneuver myself from this starting position out towards this sort of 45 degree. And the ball isn't moving, but I'm just shifting my weight across that ball, using the density of the ball to work into those areas. I can move up, I can move down, and I can just be looking to locate those sore points. If I find a sore point, same principles apply. I hold on to that, and then after I feel a period of release, I can then carry on rolling through. Great way of looking to manage those symptoms. If you have something like a massage gun, again, this can work really well to be working into those quads, around the side of the hip muscles, avoiding some of those bony points in there. Glutes and hamstrings are all the vital areas. And the final tip around managing those symptoms is to perhaps be looking to use something like ice onto the outside of the area. So that sore point, what I would call the effect, this is coming about because of an inflammatory response. So we want to be getting some ice on there each day for 5 to 10 minutes to be managing those symptoms. Now we really want to start on looking to improve the condition long term. And in order to do this comes my third tip, which is making sure that you've got the appropriate strength for the demands. What we tend to find is that running and cycling demands a lot from the hips. And if we've got some weakness around those hips, that we want to make sure that we're strengthening that so that the muscles aren't becoming too tight and fatigued and putting that pressure on the knee. So a couple of exercises that I would like to prescribe for you, and because they're nice and easy to do, can be done in front of the TV. First one is just laying on your side. We call this a clam exercise. You can lay nice and flat with the legs bent. You keep the base leg on the floor, feet in contact with each other, and we look to just simply look to bring that leg away and slowly control it down. Now, what we're looking to do here is you can just place your finger in your hip. You will just feel those hip muscles working. And as I said, it's nice to do this one because it's non-weight bearing. We can do it in front of the TV. If you find that a little bit easy, take something like a band and wrap it around your leg, and that will just apply some resistance to make that a little bit more difficult. But what we're looking to do is 3 sets of 12 on each side. And again, I would encourage you to start off with your non-injured side and compare it to the bad side. Do you fatigue quicker? Do you get pain round about the later reps or the later sets? That's an indicator that you've got that weakness. And then when you turn to running or cycling, those weaknesses are going to be found out and put that pressure on the knee. Another exercise that we can do in a similar way, so going from that clam exercise is just into what I call hip abductions. All we're looking to do is lay nice and straight, and we're just looking to bring that leg up and slowly control it on the way down. You'll notice in both the exercises I go up relatively quickly, and then I keep those muscles under tension as I slowly lower them down. This can be made more difficult with a band around the ankle or the knees to increase that resistance. But again, same principles apply. Start with the good side, take it onto the injured side, compare the differences. Now with strength work, I mentioned that stretching you can be doing every day. With strength work, I would always allow yourself a rest day in between. That allows those adaptations to occur and for a chance to see if the strength work has been a little bit too demanding for you, and you can adjust accordingly. On to my final tip, and I mentioned this is the one that is quite personal to me, because the truth is I had to drop out of running the London Marathon at one point in time because I was suffering with runner's knee. Yes, I was a sports therapist and I should have known better, but in my defence, I was very newly qualified, I was young and naive. And what I was trying to do was train for a marathon whilst playing semi-professional football all at the same time. So my fourth and final tip is that you have to manage your load. What tends to happen in our clinical experience is that people embark upon training programs, they ramp up the mileage that they're looking to achieve too quickly, and the body hasn't had a chance to adapt and cope with the excessive demands that they're placing upon it. The hip muscles start to get tight, fatigued, damaged, and it pulls down at the knee. Very common thing, and can be corrected by just making sure that you're managing your load. When we talk about increasing a load, we talk about only increasing it by about 10% on your weekly mileage. So collectively, the amount of miles you're doing in a week, we should only increase that by 10%. Research shows us that when we start going above those, that we run the risk of injury. For me, I wasn't managing the load well. I was trying to keep to my football commitments and then ramping up the mileage, and it really just wasn't stacking up. I should have known better, but it happened to me, and I knew about the symptoms starting, thought that it wouldn't affect me, and then it became too problematic, too close to race day, and I had to pull out. And I don't want you to do the same. So start early with your load management. Come up with an appropriate training program to help to either get rid or minimize your risk of runner's knee. Has that been helpful for you? If it has, do me a favor, click that like button, because it will help others to see this type of content and help them to be pain-free. But also, I look at the amount of likes that we get to know that this is the type of content that you want to be watching.